National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopathic doctor and a health expert here at Nationalnutrition.ca. Do you suffer from joint pain? Do you find that your joints are a little bit stiff in the morning, sometimes painful, especially after first motion when you get up? You may have osteoarthritis. So osteoarthritis is one type of arthritis you can experience. It is different from the autoimmune forms known as psoriatic and rheumatoid arthritises. So it is important, if you do experience any type of arthritis pain, go to the doctor, rule those out and get diagnosed. The reason behind that is the treatment is going to be different. So it's important. Arthritis just translates as inflammation of the joint. Okay, arthritis itself is not the true definition. It's not the true diagnosis. In fact, it's a symptom. So if you're experiencing osteoarthritis, there's typically a cause behind it. Now, if it's the autoimmune types, which are psoriatic or rheumatoid arthritis, your treatment's going to be different. If you have your standard osteoarthritis, there's a couple ways that you can help manage it. There's a couple different therapies you can do. Now, one of the first things you have to understand when you have arthritis, and again, arthritis typically characterized, and this is osteoarthritis, typically characterized by stiffness, pain. Sometimes you can even get redness and swelling of the joints. When you have this type of arthritis, the first thing you're going to want to do is move those joints. Okay, you're probably inclined, because they're sore, because they're achy, not to move those joints and try and rest them. However, it is important that you keep those joints active so that your body will spend resources to fix them. A few rules though with that. Any type of activity should not cause pain beyond 2 hours after the activity stops. And if you have done an activity and it causes the joints to hurt severely the next day, you've done too much and you need to start adjusting your level of activity. That being said, you always want to maintain some level of activity of the joint to, again, stimulate the body to actually heal and repair the arthritis. Now, there's a couple of reasons you can develop arthritis. Any type of trauma to a joint can actually speed up the disease process and speed up the development of arthritis. So oftentimes we see this with what we call repetitive stress injuries. So, if you have to type all day, you may get repetitive stress injuries in your fingers and develop arthritis faster in your fingers. If you have to crouch a lot, say baseball catchers, it's very common for them to develop arthritis in the knees because of their constant up and down of their kneeling motion. And again, these are types of repetitive stress injuries that can aid in the development of arthritis. There's also dietary reasons. I find there's a huge correlation between gluten intake and joint pain and arthritis. Some people also suffer from a sensitivity to a class of vegetables known as the Solanaceae or the nightshade vegetables. So this is typically your tomatoes, potatoes, peppers, eggplant, and it often includes a lot of your spicy spices. So things like cayenne pepper, chili flakes, paprika. These kind of things are also nightshades. And in some people, they can actually trigger or exaggerate your arthritis. So sometimes cutting down on the gluten or cutting down on the nightshade or Solanaceae vegetables can be very beneficial in managing your arthritis symptoms, as they can contribute to the development of the arthritis. Now, repairing cartilage is a delicate process, and there's a couple of different things you can do to help manage that. One of the first things your body's going to need to do is help remodel and rebuild that cartilage. A really important factor in this is using certain types of enzymes called anti-inflammatory enzymes or systemic enzymes. There's two major ones that you're typically going to use for arthritis. The first one is bromelain, and it's typically standardized actually to gelatin digesting units. So depending on the strength of the bromelain, it's going to have more gelatin digesting units or ability to help break up and remodel cartilage. The other one is serratia peptase, which is going to be standardized to serratia units. And again, it also helps break down damaged cartilage so your body can rebuild it properly and help reduce your symptoms of arthritis and actually even reduce the level of arthritis. The joints, the tissue, the cartilage can rebuild. I've seen it in my practice. I've seen x-rays before and after where patients, when they get their diet under control, they do proper physical therapies, and they do proper supplementation, actually being able to regrow cartilage in their damaged joints and avoid some of the more severe interventions such as surgery to replace, say, a knee or an ankle or a hip or other joint. So this is again why I'm so big on taking control of your lifestyle and using some natural therapies to help aid your body's natural healing capabilities so that you can avoid more serious interventions. In addition to, of course, dietary changes and physical therapies, the supplements are important. Some of the things you need are the building blocks for the collagen. So oftentimes what I actually recommend is to take collagen peptides. So what that is it's basically a pre-digested collagen. And the thing with that is you're giving your body all the amino acids that your body requires to then rebuild collagen or rebuild your cartilage in the joint. And that can greatly help reduce your arthritis symptoms in the long term. Right? If you don't have the raw materials to rebuild cartilage, your body's going to struggle to do it. For instance, if I give you a blueprint to build a house, but I don't give you a hammer, nails, or wood, you're going to really struggle to complete that project. Now, if I give you the blueprint and I give you the hammer, the nails, and the wood, you're going to be much more successful at completing building that house. Your body behaves the same way. It knows how to rebuild the cartilage. Oftentimes there's something either standing in its way, say a gluten intake that's causing excessive cartilage destruction, so your body works the same way. If you don't give it the adequate resources to be able to produce the cartilage, it's not going to be able to build it. So this way, by supplementing and taking in all the amino acids required to rebuild the cartilage, you're going to actually help stimulate and enable your body to fix that tissue. Additionally, glucosamine sulfate, or if you're allergic to shellfish, look into something called glucosamine hydrochloride, which is often the shellfish-free version. Glucosamine has been shown to greatly expedite the reproduction of cartilage. You could also look at adding a sulfur donor in the form of either MSM or methyl sulfonyl-methane, or something called chondroitin sulfate. What these do is they actually add an extra sulfur group, and the reason that's important is sulfur is required for the proper folding and production of cartilage. So by having glucosamine, some MSM or some chondroitin added to it, you can actually improve the efficacy of the glucosamine, speed up the reproduction of that cartilage. And lastly is joint lubrication. So one other thing you can add, especially because if you've got a joint moving and it's grinding a lot, you're going to get a lot of extra pain there. What you need to do is you need to lubricate that joint. And the way our body does that is with something called hyaluronic acid. So hyaluronic acid is essentially like a type of collagen in a way, and what it does is it helps our body to lubricate the joint, improve the fluid and the viscosity of the fluid in the joint, and allow for free and easy, pain-free movement of that joint. So I hope you've learned a lot about osteoarthritis today. I hope I've taught you a few things that you can use in your personal life to help treat and repair your cartilage naturally. So check out more videos, subscribe, and if you have any questions or comments, please post them below. And always remember that knowledge is health.